General Sylvia Jones. And it's wonderful to see Vincent Ke, the Member of Provincial Parliament for Don Valley North, back again. So at Seneca, we have a phrase, challenge accepted, and we're proud that our students and employees have stepped up so magnificently to accept the challenge of the last year. From business to the arts, technology to service industries, our highly skilled graduates are helping Ontario grow and renew as we climb out of the pandemic. And we're especially proud that we have more than 2,000 students in our School of Nursing, soon to join the front lines of the fight against COVID-19 in hospitals, long-term care, home care, wherever they are needed. Now, among those students is our first intake of personal support worker students under the government's Support and Accelerated Plan. That first intake actually started yesterday, and more are to come. And some of those Seneca students are working in the vaccination clinic, which we are proud to host in our Newnham campus gym. Now, I have to tell you more about the clinic, but I'm going to give that pleasure to the President and CEO of North York General Hospital, Karen Popovich.
Thank you, David. It is my pleasure to welcome Premier Ford, Minister Elliott, and Minister Jones to Seneca College, home to one of our local vaccination clinics. The Ontario government is a great partner to North York General and our community. Premier and Minister Elliott, we thank you and your government for looking out for the welfare of Ontarians and investing in the protection and care of patients and families. I want to recognize Seneca College for the tremendous collaboration to bring this clinic to our community. Since opening on March 15th, the clinic has been continuously booked, and there has been very positive feedback about the professionalism and care taken by the staff throughout the whole process. I commend the incredible clinic staff and volunteers, including students, nurses, pharmacists, and physicians from North York General Hospital and many partner organizations. Despite the ups and downs of the pandemic, people have come together and are working extraordinarily hard to support our community. The third wave is here, and there will be challenging weeks ahead. And nothing is more important than keeping people safe and healthy, physically and mentally. That means getting needles into the arms to prevent illness and save lives. There are many ways to get vaccinated. There are 3 local clinics booking everyone aged 60 and over. The 2 North York General and North York Toronto Health Partner clinics here, one at Seneca and at our hospital, and the Cities Clinic at Mitchell Field Recreation Centre. The North York General Clinic also vaccinates other high-risk eligible populations. Some pharmacies in our area are vaccinating 55 and up. But we know that not everyone can easily book an appointment or travel to a clinic. Our goal is to remove barriers and make vaccination available to everyone who is eligible. Our mobile teams play a critical role. They have vaccinated residents of long-term care homes, retirement homes, and congregate seniors buildings. Over 90% of long-term care home residents have been vaccinated. These teams have gone into shelters and group homes, and we are reaching out to high-risk neighborhoods, including through mobile teams and pop-up clinics over the coming days and weeks. Working with home and community support services, primary care, and EMS, we are starting the process of going door to door, vaccinating people who are unable to leave home. We know it can be confusing and the situation changes quickly. That's why it's so important to seek out reliable evidence and trusted sources. There is a lot of misinformation, especially on social media. I can't stress enough the importance of continuing to follow public health measures. The practices that have kept us safe up to now will continue to keep us safe. It will take time to reach herd immunity, so please continue to wear your masks and keep 2 meters between yourself and others who do not live in the same household. Avoid gatherings with those outside your household. But getting healthy outside is important too. Please enjoy the outdoors and the spring weather, but just do it safely. The sooner we can get infection rates down and get vaccinated, the sooner we can have our regular lives and freedoms back. Please take care of yourselves and others and get your shot as soon as you can. It is now my privilege to invite the Premier of Ontario, Doug Ford, to say some remarks. Thank you.
Well, good afternoon, everyone, and Karen, thank you. And I want to thank all the frontline healthcare workers right across the province, but I want to give a special thanks to the folks over at North York General. And David, thank you for having us back here, and I can't wait till you get those students back into the healthcare system. We need every one of them. Last week, I said we were in a fight with a new enemy, one that is rapidly evolving. The game is changing, and we need to shift our response to stay ahead of this virus. That's why we implemented a province-wide emergency brake to slow the spread of the virus and give us time to get more needles and arms. As I said last week, we're fighting a new enemy. These new variants, they're more contagious, they're putting people in the hospital sooner and for longer. As we confront this new challenge, we'll remain nimble. We will never hesitate to do what's needed to protect the people of Ontario. Over the Easter weekend, I saw the same news coverage as you did. Big groups of people in malls and other retail settings, too many people gathering indoors. I've been meeting with the Chief Medical Officer of Health and the Minister of Health and our entire team over the weekend to discuss the options for how we can address the issues we're seeing in retail settings. Because the situation is rapidly evolving, it's changing day by day, hour by hour, and we need to be ready to adapt as we see issues emerge. And getting ahead of this virus requires action on a few fronts. That means taking action to slow the spread of this virus and getting more needles into the arms of Ontarians. Starting today, Ontario will begin phase 2 of our vaccine plan, focusing on protecting those at highest risk. Building on the work done to protect long-term care home residents, retirement homes, frontline care workers, and our oldest seniors. We're now moving to protect those with highest risk health conditions and their caregivers. And we will be immediately targeting hotspot postal codes to help get this third wave under control. As we do, we're finalizing plans to vaccinate workers in settings where we're seeing outbreaks. Every single vaccine dose we have in our hands has been allocated to someone who has booked an appointment. And almost all the doses we currently have on hand we received just over the Easter weekend from the federal government has been allocated. The good news is, now that we have received additional supply, we're finally able to dramatically increase pharmacies and expand access to vaccines in primary care. More mass vaccination centers, including those that are paused operations because of the lack of supply, are coming back online. All Ontarians 70 and older are now eligible to book their vaccination appointment by visiting ontario.ca/COVID vaccine or calling 1-888-999-6488. And for all Ontarians 55 and over, we're rolling out vaccinations at more than 700 pharmacies across the province, with more added each week. You can visit ontario.ca/pharmacy COVID vaccine to find a neighborhood pharmacy that is administering vaccines. This is the largest mass vaccination campaign in our province's history, and we expect to distribute 9 million more doses by the end of June if the supply from the federal government is delivered as expected. If we all stay the course, keep following the public health guidelines, and get a vaccine when your turn comes, there'll be a brighter summer ahead for all of us. Thank you, and God bless the people of Ontario.
Okay, we'll go to the phone line for questions. First question, please.
Randy Rath, Cs9tv.
Hi, Randy.
Hi, Premier. We had a situation in Hamilton yesterday where there were hundreds of vaccination appointments that went unfilled. Essentially, the reason was that the provincial portal, you couldn't book on it unless you were over 70 and the age wasn't dropped, in the opinion of the city, quickly enough. What are you going to do to make that portal more reactionary so that as we move to the different groups that can be vaccinated in phase 2, that we don't see a similar situation happening?
Yeah, we're giving the flexibility to the public health units as we move forward. I'm going to pass this to the Solicitor General. Thank you.
So in reference to the Hamilton PHU, as soon as we learned that people were not actually taking those appointments, as of this morning, the Hamilton PHU is now accepting 65 and above. But it speaks to the importance of people working together to get those over 70s out. It does not mean that Hamilton has completed vaccinating their over 70s. It means that more people have to access those sites, whether it is through the online portal or through the telephone system. They're there for individuals to make sure that they get the closest vaccination that is convenient for them. Thank you.
Follow-up?
There's a situation in Niagara as well where they're going to vaccinate 4,000 education workers. In today's technical briefing, we were basically told that the province provides guidelines to the public health units and that they should follow them, and that those guidelines are meant to prevent death. We're not seeing death in teachers or educational workers to a large extent, and they also told us that if they put 4,000 needles into arms of teachers, there's 4,000 people that are more vulnerable that are not going to receive those shots. Has the Niagara Public Health Unit allowed teachers to queue jump here?
Okay, before I pass it over to the Minister of Health, you made an excellent point, Randy. You know, folks, I'm going to read off these numbers. They're staggering numbers. We still, over, I believe it was 97% of mortalities in hospitals are people over the age of 60. So that is where we see the mortalities, and those are the people we have to focus on. These are the numbers just recently. So 80 plus in Ontario, over 88,239 have still not booked an appointment. And as Karen was saying, we'll go right to their location, their area, their condo, their apartment, their house, if we need to. But what's concerning is 88,000 have not booked. From 75 to 79 years of age, over 108,000 have not booked. Over 70 years, 70 to 74, 279,000, almost 280,000 people have not booked an appointment. And 65 to 69, over 618,000 people have not booked an appointment. Folks, we need, if you have a loved one, if you have a mother, a father, a grandparent, please get them booked in. I can't stress this enough. As we see more vaccines coming in, we need to get those appointments booked for any reason. They have a problem online. We just gave out the 188 number, and I encourage everyone, please sign up. I can't stress it enough. It's absolutely critical that we continue taking care of the most vulnerable, and that is 60 plus, and that's where we see mortalities. As much as they've dropped drastically, that's where we see the mortalities happening in the hospitals. I'll pass it over to the Minister of Health.
Well, our plan currently calls for people to be vaccinated based on age and risk. And so there are many people who are not able to work from home. Teachers are one of those groups. However, the plan that we have developed also deals with special education teachers who are dealing with children with special needs, who may come into contact with saliva, be struck or perhaps bitten in some cases by the students that they're dealing with. Those are the situations that we're taking a look at where there is a much higher risk to those special education teachers, and that is a group that we do want to have receive those vaccinations because of that higher risk factor.
Next question.
Mike Crawley, CBC. Please go ahead.
Hi, Mike.
Premier, you alluded to the fact that you're finalizing plans to vaccinate workers in settings where there have been outbreaks. But as Minister Elliott was just saying, at the moment there's no plan to vaccinate frontline workers, essential workers who cannot work from home, like teachers, until mid-May at this point. Can you explain why you're not getting to them sooner? Why these people are still having to go to work and don't have the opportunity to get vaccinated until mid-May at this point?
Well, Mike, we're going to be rolling out the discussion that we've been working all weekend, which actually we've been working for weeks, based on phase 2 and where we're going. 3 areas. One that I just mentioned, we have to get the most vulnerable, the most elderly, those appointments booked. We have an excess of probably 1.4 million. I'm being conservative on that. People already booked. So that's one part of it. Part 2, we have to go in to the hot areas, the hot spots, and really focus on targeting the hot spots. And number 3, we have to go into the high priority essential manufacturers, be it the meat packers, the poultry, the manufacturing sector, large companies. You saw what happened in Amazon out in Brampton. We have to start focusing on those areas in the hot spots. And I know we're working on a plan as well for the teachers, and we'll be working along with the boards, the Minister of Education and the Minister of Health.
Follow-up?
Premier, you also said that you've been meeting with the Chief Medical Officer of Health about whether anything more could be done in the way of public health restrictions. I was almost anticipating you were going to announce something, but then you didn't. You've got the medical officers of health in Toronto, Peel, and Ottawa all calling for much stronger measures, including a stay-at-home order. And there's a report that the Public Health Measures Table actually recommended a stay-at-home order. Why have you not moved to make restrictions tighter than what it is that you announced on Thursday?
Well, Mike, this is moving day by day, by hour. I think we made a massive move last week by basically shutting down the entire province. That was huge, shutting down thousands and thousands of business that I hate doing. But we're going to have further restrictions moving forward very, very quickly. And again, we have to focus on where we see the problem. 3 regions, York, Peel, and Toronto, represent 60% of the COVID cases. So when you have an inferno going on somewhere, you have to turn the hoses there. You have to continue doing the whole province, but we're really focusing on the hot areas, and we'll be sending mobile units into those hot areas and into these companies to make sure that we target those. And hopefully once we do that, we're going to see the numbers come down. And in saying that, folks, we don't have an unlimited amount of vaccines. As I told you, yes, the feds dropped quite a few vaccines onto us just a few days ago over the weekend. They're already being distributed. They're going out to 700 pharmacies, primary care facilities, mass vaccination centers. But we need more. Those are all taken. They're all spoken for. So if you change anything, just think you're taking it off an elderly person. We need more vaccines. I know it sounds a little crazy. Oh, we got, I saw some tweet from a federal minister. Oh, we have 1.3 million in the freezers. We just got those. We literally got them a few days ago. So before that, we're running out, and we'll continue to run out. As soon as we continue a consistent flow of these vaccines, then we'll be able to expand the program. There's no one more that wants to expand this program than I do.
Next question.
From Nicole Lampa at CTV News Kitchener. Please go ahead.
Hi, Nicole.
Hi, Premier Ford. How are you doing today?
Oh, we're hanging in there. We're gonna get through this, Nicole.
You just said we will have further restrictions very, very quickly.
Yep.
Is that suggesting that we will be getting a stay-at-home order?
Well, we'll discuss that tomorrow. What I saw, Nicole, is the same thing you saw. A lot of people saw. You know, you go by Yorkdale, you couldn't get a parking space. You know, it was absolutely jam-packed. And I truly was hoping that, you know, people wouldn't be going in there to the volume that we saw. Folks, you know, this variant is taking off. And please, when you can, follow all protocols. Make sure you know, when you can, stay at home. We understand you got to get out, get fresh air, God bless you, but do it responsibly. But a lot of people were going into the malls and doing their little wander around and coming out with no bags. So that tells me they were just out for an evening or a daily jaunt. You can't do that. You know, if you have an essential item that you have to buy, and, you know, I'm sorry, but going to the malls is not essential. What's essential is going to buy food, going to buy medicine out of the pharmacies, and getting your vaccines. We still have 1.1 million people that have not been booked. So spend your time booking your loved one, your neighbor, your friend, your grandparent into a vaccination center.
Follow-up?
So we are seeing medical officers of health going above your shutdown order. Like in Guelph, Section 22 was ordered. They are technically in the orange, but yet the medical officer of health is ordering all students to go virtual tomorrow. Here in Waterloo Region and in Toronto, there is still in-person learning. There's so much confusion. Parents are confused. If medical officers of health in Peel and Guelph say schools are not safe, what makes them safe in other parts of Ontario?
Actually, I'm going to disagree. Dr. Lowe must have said it 50 times yesterday on the news that schools are safe. Folks, across the province, we're looking at 98.5%, almost 99% of the schools are currently open. 99.88% of students do not have active cases. 99.32% of students have never reported a case of COVID. 99.83% of staff do not have an active case. 99.89% of staff have never reported a case of COVID. Where we saw the problem, and everyone remembers this, at Christmas, when the kids go back into the community, that's where it's happening. It's not happening in the schools. It's happening when there's a community spread in hot areas. I get it. But the schools, and I give all the credit to the principals, I give all the credit to the great frontline teachers that have been doing an incredible job. That's the reason we're at 99%. And they're doing an incredible job. So I just want to thank them for that.
Next question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Rob, are you
Hi,
there?
Premier. Sorry, I was a little bit slow to unmute there.
Okay.
Here we are in another situation where, like last week, you're planning an announcement, telling us about an announcement the day before. If you're going to shut things down further, if you're going to do a stay-at-home order, why not just tell everyone today so everybody knows where they stand? Because, you know, I heard a lot of complaints over the weekend about changes and everything moving from one day to another, and people are just looking for a little more certainty, I think.
Okay, Rob, and I respect that. And you know something, I don't even disagree with you. I don't disagree with other people. But folks, you can't just make a decision and hope it's going to stick for 2 weeks. This variant is moving hour by hour, day by day. So we have to move with it and be nimble and be quick. And that's what we're doing. I wish, Rob, I could say, hey, guys, we're doing this and we'll be okay in 3 weeks. That's happened before. And it just seems as soon as we get it, another variant, the Brazilian comes in, the UK variant comes in, and it changes the whole game. But I hear you, Rob. We're going to be very clear tomorrow on what we're hearing from our chief medical officer to secure areas. And there are 3 areas. Again, you know, we're going to target the big employers in hot areas. We're going to make sure we target neighborhoods in hot areas. And again, thank you, Karen, and EMS. The EMS paramedics are champions, by the way. They're the folks that get in there and do a good chunk of the vaccinations and the mobile units along with other frontline healthcare workers. And that's what we have to focus on. And we need more vaccines. I know we got a whole bunch of them, but they're all accounted for. So to allow us to be nimble and quick and go in and do these areas, plus adding the 700 pharmacies, we need more vaccines.
Follow-up?
So thanks, Premier, for that. If you're a teacher, and more boards were moving today to go online tomorrow or soon, if you're a teacher or if you're working in a factory where there's been cases like the Amazon warehouse you talked about, so can you just let people know how soon in those categories they can expect vaccines?
So we're working with the public health units, but what I can say, Rob, everything takes resources. As soon as you shift it, you're taking resources from one area, putting them into the other. But what I encourage people to do, you know, there's probably in excess of over 1 million people, 55 and older, that are working in some of these factories, essential service manufacturing. Please just go out, be proactive, and get an appointment. We're coming to you. We're going to come to these large employers into the hot areas, be it Peel is about 60% hot right across the board. I just got off the phone with Dr. Lowe, and he's doing a great job. I was speaking to Dr. Davila on the weekend, and they're all working their backs off, and they're all doing an incredible job. But when we're going to focus together and focus on those key priorities.
Last question.
From Laura Stone at the Globe and Mail. Please go ahead.
Hi, Laura.
Hey there, Premier. You know, you keep talking about how you need more vaccines, but we also know that appointments aren't getting filled. So how can the public have faith in your government's ability to actually get these vaccines out the door when we see them sitting in freezers? We know that there's appointments that are unfilled. I mean, why can't you get this done faster? What's the problem here? Okay,
so I'm going to respectfully disagree with you here. We're doing 2.638 million vaccines so far, hammering the whole country. We're doing more than anyone, with both hands tied behind our back with dribs and drabs of vaccines. To your point about we have vaccines in freezers, what really drives me crazy is when you know, some folks, I don't know, be it the media or be it maybe some political folks, are saying, oh, they have 1.3 million vaccines. What you don't tell the people, which I'm telling them right now, folks, we just got them 2 days ago. Over the last few days, they just literally landed on our doorstep. It takes a day for the distribution. We got it out, and we're ready to go. We are ready to go. We have over 1.3 million appointments booked. So, you know, just keep booking them, bringing in more vaccines. The 700 pharmacies, we'll be able to get out more. We'll get more out with primary care. But let's if we're going to say that, let's be honest with the people. We just received the vaccines, and folks, we need more vaccines. Simple as that.
Follow up?
Okay, thank you. And just lastly, you know, there's been calls from other parties and experts to vaccinate all education workers, 200,000 people next week while there's a break. Why wouldn't you do this if you want to keep schools open?
Well, that's an option. As I always say, everything's on the table. We'll be announcing over the next day or so where we're going with that. We're working with the Minister of Education. I just got off the phone with the Minister as well. But I think right now there's actually total in the education system, there's 300,000. And as the Minister said, there's a special ed teachers that we have to focus on as well. But I'll pass the balance over to the Minister of Health. Thank you.
Well, as the Premier earlier indicated, every time you make a change and to vaccinate all teachers, which is a group that, of course, we want to get to because they cannot work from home, that then means you're also taking supplies away for some of the seniors too. So you need to be fair. You need to continue to follow the plan based on age plus risk, and that's what we're constantly assessing. As the Premier indicated, we have to be nimble. This is, the variants are moving very, very quickly, and we want to make sure that we can get to the groups that are most devastated by this vaccine, by this COVID variant, and those are the groups that we're focusing on. There are certain hot areas that we also have to deal with where there's a high degree of transmission. So we're constantly reevaluating and assessing based on what's happening in communities with the greatest breakouts of COVID.
Thanks, everyone.
Okay, thanks, everyone.